One more on this Josh, not Ernest, because I view this Ebola and this immigration thing overlapping in several respects with respect to the competence, ideology, intentions of this administration. Josh Earnest, today. Cut 5, go.
And the president continues to be open-minded about suggestions that people may have about the best way to protect the American people.
Stop. No, he's not. They pull this crap all the time. I'll work with anybody in the Republicans in the Congress who will work with me. No, you won't. Remember, you have a pen and a phone. When it comes to this, quarantine. I'll work with anybody. No, you won't. I'm open to the best ideas. No, you're not. Go ahead.
Those sorts of decisions are going to continue to be driven by science and by a priority that reflects the need to make sure that we're not placing an undue burden on those healthcare workers that have volunteered their time to go and try to stop this outbreak.
Let me understand this. Somebody in this country volunteers to go over to one of these 3 countries that has an Ebola epidemic. When they come back, we want to put them in a 21-day quarantine. Really should be more, but a 21-day quarantine. And that's an undue burden. It's not an undue burden to go over there in a hot zone. It's an undue burden when you come back to the United States of America and we say, look, we don't know what the hell you have. Maybe nothing. Great. We hope you have nothing. But for your sake and the sake of the rest of the people in this country, we're going to quarantine you for a few weeks. Oh, the undue burden. What am I going to do? You know what kind of burden men and women in the military face? Away from their families for long periods of time. Sent to hellholes they never heard of before. Facing barbarians of every stripe and kind. That's a burden. 21 days in the United States and quarantined and getting your income paid, your salary paid. That's not a burden. That's a responsibility. And if you're a doctor and a nurse and you go over there, you should be willing to do it, in my humble opinion. Oh, Lord. Then we have Bill Plant, CBS News senior White House correspondent. Cut 7, go.
Over the weekend, the White House pushed hard against New York and New Jersey and other states to drop the quarantine. They plan to have new guidelines to announce later this week. They say the new quarantine program in New York and New Jersey is not grounded in science.
Why not? Quarantining people for 3 weeks is not grounded in science? It sounds like it's grounded in science to me. You know what's not grounded in science? Global warming. You know what's not grounded in science? Utopianism. You know what's not grounded in science? What the CDC's doing right now. As a matter of fact, there was a piece written by Heather McDonald. I wish I still had it. From last week. And she writes a piece about, and I've talked about this myself, how the CDC in so many respects has become a left-wing political advocacy institution, pushing social justice and social engineering and all these other things. Gun control, behavioral sciences, typical of any government bureaucracy, gets completely out of control and then it advances an agenda that has nothing to do with its original mission. That's exactly what goes on with this CDC and the NIH, too. I happen to know there's just an enormous amount of waste over there at the NIH. But you're not allowed to say it. Here's the piece, Heather McDonald in City Journal last week. The public health establishment has unanimously opposed a travel and visa moratorium from Ebola-plagued West African countries to protect the U.S. population. To evaluate whether this opposition rests on purely scientific grounds, it helps to understand the political character of the public health field. For the last several decades, the profession has been awash in social justice ideology. Many of its members view racism, sexism, economic inequality, rather than individual behavior, as the primary drivers of differential health outcomes in the U.S. And according to mainstream public health thinking, publicizing the behavioral choices behind bad health, sex, drug use, overeating, lack of exercise, blames the victim. The Centers for Disease Control and Prevention's Health Communities program, for example, focuses on unfair health differences closely linked with social, economic, or environmental disadvantages that adversely affect groups of people. CDC's Healthy People 2020 project recognizes that health inequities are tied to economics, exclusion, and discrimination that prevent groups from accessing resources to live healthy lives, according to Harvard public health professor Nancy Krieger. Krieger is herself a magnet for federal funding, which she uses to spread the message about America's unjust treatment of women, minorities, and the poor. To study the genetic components of health is tantamount to scientific racism in her view. since doing so overlooks the impact of discrimination on health. And, of course, the idea of genetic racial differences is an anathema to Krieger and her left-wing colleagues. And it goes on. So this is what's happening now in many, if not most, of these public health institutions, certainly at the CDC and the NIH. So when governors, three blue state governors, Illinois, New York, and New Jersey, two radical liberals, one liberal Republican, put these quarantine measures in place, they are set upon, they are attacked, not because of science, like this spokes idiot for Obama keeps going on, but because of politics, pure and simple.